Cancer is a problem that occurs when some of the body's cells start behaving erratically and deciding that they can do their own thing. Biologically, there are a lot of different things happening, but cancer is a process where parts of the body decide that they can do their own thing and they start replicating without thinking about the rest of the body. They start behaving independently, essentially. And they can do that, and they can spread throughout the body and cause damage and eventually kill a person. So oncologists and other doctors who treat cancer conventionally usually work with about three basic options. They're using surgery, they're using chemotherapy, and they're using radiation. I mean, there are other drugs that they use, but that's the basic approach to treatment. And there are some cancers for which those are very effective, but the types of cancers for which those are effective are very few. And these treatments are used across the board for most types of cancer. And in many cases, those treatments are of very little effect. Certainly, I recommend for most patients who have significant tumors, surgery in most cases is necessary. But in a lot of cases, chemotherapy or radiation are of limited necessity or limited efficacy. They do have some validity, but the actual benefit to the patient is very small. So there are a number of side effects associated with chemotherapy and radiation. People are familiar with hair falling out and losing weight, but there are a lot of other, often more serious side effects that can be associated with it. Mouth sores where people can't eat properly, numbness of the hands and the feet. Immune system is often really severely affected, and that can lead to very serious infections, people being hospitalized. All of these things happen and are very serious. Sometimes these drugs are necessary and we have to find ways to manage these symptoms, and sometimes that's what I'm doing with patients. But in some cases there are also alternatives, and the concern is that we're not necessarily getting to the root cause here, and there's always a concern that the cancer will return. People can develop cancer for a variety of reasons, but oftentimes it's associated with exposures to toxins in their environment, and those can come from a number of different places. People who work with certain substances in dry cleaning operations, for example, are at increased risk of certain types of cancer. People who work with pesticides are at increased risk of certain types of cancer. People who dye their hair even. Certainly people who eat in specific ways are at increased risk of certain types of cancer. Red meat across the board seems to be strongly associated with risk for many cancers. So many patients come and see me who have already done conventional treatments for their cancer, they're in remission, and they're looking to prevent future problems. And so I want to look for them to figure out, okay, why did they develop cancer in the first place? And sometimes there are tests that we can run that will give us some indication, that will look for toxicities, that will look for immune system problems that we can address. And I'm going to use a variety of different treatments to help that. And a lot of that centers around lifestyle modification. We can work with their diet, we can work with, detoxification, we can work with exercise and discouraging certain bad habits and encouraging certain good habits that are going to help them reduce their risk of ever getting cancer again. I use certain very specific agents. I'll use mistletoe with patients. I will use high-dose vitamins with patients, vitamin D, vitamin A, a number of vitamins which, in the right doses, can be really helpful in reducing people's risk of cancer, and that's certainly been shown in research. And so I'm using a number of different agents combined with overall lifestyle changes and recommending other types of approaches to thinking about their cancer, looking at things from an emotional perspective, looking at things from a spiritual perspective, to make sure we're treating the whole person to help them get better and to never have to face cancer again. So if a patient comes to see me and they have active cancer, almost always they're already seeing an oncologist, and if they're not, I recommend that they do. It's important they understand what their treatment options are, and they're almost always going to require some conventional treatment. We want to make sure that they're getting the conventional treatment that they need, but we want to make sure that they're getting what's necessary and not more. Sometimes, they can get too much and it can be a harrowing experience. We want to limit that. But what I'm looking to do in those situations is support them wherever they're at. So I want to do things that might reduce side effects from any treatments that they're doing. I want to do things that support their immune system and help them to get through the process and to make it such that when they're through, they're not going to have to deal with this again. And I use a variety of different things to do that. sometimes what I'm looking to do is to help them maintain or gain additional weight because they're losing weight because of their treatments. And so I'm using, fish oil. I'm using specific dietary interventions, making sure that they're eating, high-calorie foods that are healthy. They're not drinking, really sugary drinks to do that, but they're actually eating whole foods that are healthy that are going to make them get better in a real way. I'll often use herbal treatments in patients who are undergoing cancer therapy. I might use ashwagandha, for example, in someone who's doing radiation treatments, something that will increase the effectiveness of their treatment and decrease side effects. We might use aloe vera topically to decrease or prevent burning that can occur when people are doing radiation. And we use a variety of other herbs that can be really helpful when people are undergoing cancer treatment. My success rate in treating people in remission, preventing future cancers, has been very good. When we look at patients who've had cancer, we're not talking about weeks or months here. We're talking about years. You can't tell in a short period of time whether or not your treatments have been effective. And certainly looking in the long term at the way my patients are and how they're doing, things have been good. So basically what we're talking about here is a natural living lifestyle. Cancer, even though it is really scary and can be very serious, is a lot like many other diseases in terms of what causes it and how we can treat it. And at base, what we're looking to do is change the way that people live, change the way that they think about how they eat, how they behave, the kind of exercise they get, the kind of interactions they have with other people so that they can live more healthily. They can reduce their risk of developing cancer in the first place, or if they've had cancer, they can reduce the risk of having cancer again in the future.